Mr. President, I want to thank a lot of people, including the staffs of committees, Senator Sanders' staff, Dalia Melendez and Travis Murphy, Senator Burr's staff, Natasha Hickman, Maureen O'Neill and Anna Abram, Senator Coburn, Jabari White, my own staff, Elizabeth Lopez, Jeremy Hayes, and Joe Donahue, and all the hard work that's gone into this legislation. I think it's well known to my colleagues that this is an unprecedented piece of legislation in that for the first time, it's going to provide our veterans with a choice. And there are many other provisions that I'd like to discuss also, but have been, and I'm sure my colleague from Vermont will be addressing those. But, Mr. President, there are, according to a recent VA audit, over 57,000 veterans have been waiting for an appointment for over 3 months to see a physician at the VA. Over 63,000 veterans over the past 10 years have never been able to get an appointment at all. There are allegations in the Phoenix VA hospital that 40 veterans have died. Today, dated June 11th, the Federal Bureau of Investigation has opened a criminal investigation into allegedly misleading scheduling practices at the Department of Veterans Affairs that may have concealed how long veterans had to wait for appointments to see a doctor. Our Phoenix office has opened a criminal investigation, the FBI Director James Carney said in response to a lawmaker's questions at a hearing Wednesday. If that isn't an emergency, I don't know what is. If it isn't an emergency that the very lives of the men and women who have served our country with honor and distinction are being either jeopardized or in allegations of absolutely being lost through malpractice and malfeasance, if that isn't an emergency, I have never seen one before this body. I urge my colleagues to vote this for what it is, this budget point of order. This is an emergency. If it's not an emergency that we have neglected the brave men and women who have served this country and kept us free, then I don't know what an emergency is. There's hard work been done on this legislation, hard work and a lot of compromises. And I'm happy to see that the majority of the veteran service organizations are now in support of it. Is it a perfect piece of legislation? No. Is it exactly what I wanted? No. Is it exactly what the senator from Vermont wanted? Absolutely not. But this is an emergency. I tell my colleagues, if it's not an emergency of how we care for those who have served on the field of battle, then nothing else is before this body. It breaks our hearts. It breaks Americans' hearts when they hear and see these stories of these brave men and women and the neglect that they've suffered, the lack of a fulfillment of an obligation we made to them. So, Mr. President, I hope we'll vote against this budget point of order. I hope we'll vote unanimously, 100-0, to pass this legislation, send it to the House, go to conference, get it to the President's desk, and start healing the wounds that have been inflicted on these men and women. There's no way we can ever compensate for those that have gone without the treatment that they've earned. But at least we can expeditiously fix this problem to the best of our ability. Is this the ultimate and final solution to these problems that have been uncovered? No, but it's a beginning. It's not the end of the beginning, it is a beginning. And there will be more proposals before us, and there will be more efforts to fix this gaping wound in America's conscience. But, Mr. President, I urge my colleagues to vote to waive the budget order. This is an emergency, and I urge my colleagues to vote for the bill. And again, I thank everyone for their involvement, especially Senator Burr and Senator Coburn.